NBC News cameraman Ashoka Mukpo, who was diagnosed with Ebola on Thursday, has landed in the U.S. He's the fifth American to be diagnosed with the disease. So how does the Centers for Disease Control and Prevention track the spread of the Ebola virus? I'm Desiree Brown for USA Now on Monday, September 7th, 2014. The CDC is using a process called contact tracing to find everyone who might have come into contact with someone with the deadly disease. For example, in Texas, authorities have finally tracked down the missing homeless man who rode an ambulance with the first American Ebola patient, Thomas Eric Duncan. He's currently fighting for his life. Here's how contact tracing works. Once Ebola has been diagnosed, the patient is isolated and provided care, and then a patient timeline is established to determine when the patient first got sick. Then the patient is asked about their contacts, relatives or medical staff whom they've been in close proximity with recently. Once those contacts are found, like the homeless man in Texas, they're monitored for 21 days for any signs of the virus. If they have the virus, the cycle starts again, with all that patient's contacts being found and watched for 21 days. Ebola symptoms can appear anywhere from 2 to 21 days after exposure. Those symptoms include fever and fatigue by day 5, vomiting, blood, and behavioral changes by day 10, and seizures, internal bleeding, and possible death by day 12. Although experts say Ebola is less scary than the flu, even one missed contact can keep the outbreak going. For more on contact tracing, search for our graphic at usatoday.com.